Complementary medicine has a lot of potential to reduce the symptoms associated with endometriosis and to improve the general health and well-being of women with the disease. The benefits of complementary medicine are that it can reduce pain, improve mood, improve general health and well-being. However, the evidence base is very small. There's very few clinical trials using rigorous methodology, and more work needs to be done.
Complementary medicines is a very, very broad category. Everything from acupuncture to acupressure to homeopathy to yoga. So it's hard to combine all of those risks into one simple answer. But risks can include interactions with current medications that you're taking. Just because something's natural doesn't mean it's safe and can be combined with anything else. Water, probably one of the most natural things, is really not good for you if you drink litres and litres at a time. Same with any natural medicine. It can have side effects and it can interact with your normal medications. So it's really important before you start, tell your GP or your specialist about what you're planning to take to make sure there's no interactions between it and whatever you're currently taking. There are a number of complementary medicines or therapies that can help women with endometriosis. It really depends on the symptom that you're trying to treat. Endometriosis is so much more than just pain. So if you are trying to treat pain in the pelvis, so this is pain that you might be having with your period or on a regular basis outside the period, there is some evidence to suggest that regular acupuncture, probably around twice a week, might be able to reduce the amount of pain that you have. If you're getting some depression or anxiety with your endometriosis, which is again quite common, a complementary medicine that might be useful for you is St. John's wort. This is an alternative to antidepressants such as Prozac. But you need to speak to your doctor if you want to start taking this medication, because it can interfere with not only other types of antidepressants, but also birth control pills. The other things that we have some evidence for, although it's not really strong at the moment, is yoga. There is some evidence that yoga, practiced on a regular basis, can help lift mood and reduce pelvic pain symptoms. And finally, meditation, such as mindfulness. Again, not a lot of evidence, but there is some promising evidence that regular mindfulness meditation can help boost mood again and reduce pain symptoms. We expect that herbal medicines, such as those based on traditional Chinese medicines, might also help, but we really need to do more research before we can be sure that these are effective for women with endometriosis.
Complementary medicines don't work for everyone, and it's important that we do more research to be able to identify which remedies are most likely to work for your situation. Complementary medicine can be part of a multidisciplinary team approach to the management of endometriosis.
Your doctor or your gynecologist is your primary healthcare provider. It's really important that if you take something or start doing a new technique, let them know. If you're taking something internally, like a herbal medicine or a supplement, it might interact with some of your current medications. So it's really important that they know about this. But even if you're starting acupuncture, doing a yoga program, it's good for them to know so they can keep it on your notes and track and see how it's helping or not helping you.
It's important to find a complementary medicine team that works for you, because we're all individuals and your experience of endometriosis is not the same as the next woman's.